Hello everyone, welcome back to Yashoda Hospitals online segment, the Health Talk session. The lower back supports the weight of the upper body and provides flexibility in motions like stretching, bending. I'm sure most of us have experienced lower back ache at some point or the other. So what are the common causes of lower back pain and what are the treatment options and when should one seek immediate medical attention? So let's discuss about lower back ache in our today's episode. I'm Dr. Lakshmi and let's welcome Dr. Bala Raja Shekhar, consultant neurosurgeon from Yashoda Hospitals, High-Tech City. Welcome, doctor.
Hi everyone, I'm Dr. Bala Raja Shekhar Chandra, senior consultant neurosurgeon. Basically I deal with endoscopic spine and back and neck related issues. We'll have a good discussion today.
So doctor, isn't it interesting that back pain or lower back pain is one of the leading cause of disability in India and everyone must have experienced back pain at some point or the other. So what is the problem with the back pain in general, doctor?
Exactly, if you see, earlier when I was a kid and when we were very young, if someone has back problems, we used to say that they become old, that's why they're having back pain and all. But if you see today, everyone is having back pain, starting from the kids to the college going children and at the same time the working professionals, young professionals. And if you see the age patterns of back problems, we see these problems are very common below 40, which was uncommon in Indian population some 20 years back. Why is it happening? If we see that, the answer is simple, the changed lifestyle. If you see the work pattern 20 years before, it was mostly physical work and people used to cycle, they used to do physical activity a lot and the diet used to be controlled and it was majorly homemade food and all. So all these things changed drastically in these 20 years. That is one side. The other side of the story is the dietary habits are also very bad. So the people, though they are healthy, I mean obese, earlier days used to, if the person is chubby, we used to call him healthy. Now the chubbiness is different, it is obesity. And because of these, there is excessive burden on the spine, which result in the spine problems.
So do you think the pandemic, most of us were working from home? So do you think even that was one of the contributing factor to this?
Yeah, exactly. If we say the pandemic should have been a boon for many because people did not have any need to go to office. They had all the time. They could have done exercises. They could have become more fitter. But the contrary happened. So more junk food and less physical activity resulting in more problems for the back.
So back pain, do you think it's more of a skeletal problem or a muscular problem? What do you have to say about this?
So if you see the back, what is spine? If you come to the center aspect of whatever the discussion is today. So if you see the spine, what is spine and why is it so important for us? So if you see all the activities of the body, maybe the hand movements, maybe the way I'm talking to you, maybe the way I'm responding to you, everything is controlled by the brain. But someone has to carry the impulses from the brain, the commands from the brain to the organs, that is carried out by the spinal cord. It is a nerve which carries the signals from the brain to all the parts of the body. So the softer nerve is protected by a skeleton, the bone structure called the vertebral column. The difference between all the bones and the spinal bone, vertebral column, is it's not a single bone because it should have movements. The neck movement should be there, the back movement should be there. So it is like boxes. It's and these are protected by joints, ligaments, muscles, discs, and many structures. So any abnormality in any of these structures can result in the back problems. And the most common thing which we are seeing nowadays is the muscular pains. So why the muscular pains are happening? Because of the lack of exercise. See, if the muscles are strong, they will hold the skeleton, the vertebral column strong so that the weight bearing is easy. But if the muscles are weak and if the body weight is more, so the muscles have to do more work with less strength. So ultimately the weight is going to fall on the spine and whatever the problems we are seeing are the results of this.
So doctor, what are the most common causes of back pain? I mean, do you think it's always genetically determined?
So the genetical causes for the back pain are not still under the research. There are many things going on about the genetic studies of the disc. Why is the disc prolapse happening in some people and in not some people? So, but if you see the genetics play a major role in the strength of the bone. So how strong your bones are. If you see the races, white race, black race, and Asians, their anatomy is different and the bone structure is different. the way the weight bearing is different in different population, but hardly the genetics per se causing back problems is not still elicited till now. Most of the thing is the lifestyle related and environmental.
So you've just mentioned that most of the causes are lifestyle related, and I'm sure many of us have experienced lower back pain or back pain at some point or the other, especially after lifting heavy weights or playing sports over the weekend. So what should one do if one experiences the lower back pain? I mean, should they see a doctor right away, or what are the precautions that one can take immediately?
We had seen a few people or many people presenting to us that they lifted the weight and suddenly it was a sudden severe excruciating pain which will not allow them to move, and they had to be bedridden during that time and all. So these things happen. So whenever a disc prolapse or something happens which compresses the nerve, the mind or the body tries to restrict your movements by causing muscle spasm, which causes very severe pain restricting your movements. The people mistake it for something dangerous happen. So during that time, what has to be taken is immediately immobilize him, so rather than moving. And some people, we have seen people going to the massage people or somewhere abnormal exercises and all, and then coming back with us with increased pain. So that should not be done. If there is a severe spasm and pain, please don't do any activity which will increase the pain. So just take rest, give some analgesic and take to the doctor immediately as soon as possible. Because if you go to a doctor, he will give you proper advice what to do. So what is the next program, how to proceed further. So rather than going to the doctor at increase the pain and at worst moment, it's better to go to him the sooner the possible.
Talking about home remedies, is ice better or heat?
So it's simple that any ice or any heat is a pain relief agent. It causes pain relief. So what is the mode of injury? Is it a sports related injury, or is it inflammation, or it is any fall or something, or as you've been discussing, it is a simple muscle catch? It depends on what we do during the time, application of ice or the heat. So normally if you have a back pain or before going to physiotherapy and all, we advise them go with the heat so that you will get some relief, and then you can go on with your routine activities and all. But if there is inflammation and swelling, obviously the ice or cold temperature is going to give better relief during that time. And any pain relief agent like NSAIDs or muscle laxants will help relieve that spasm temporarily, so that you can go to hospital and visit a doctor.
So doctor, are there any red flag signs that one should look out for and seek medical advice immediately for back pain?
As we have been discussing till now, the back pain can be because of many reasons. It can be a muscular cause, it can be a bone cause, it can be a disc cause, or anything. So what are the things which prompt us to think, no bros, this is not a normal pain, it needs immediate medical attention? So if you see, as we had been talking, the spinal cord carries the nerves to various organs of the body, and they transmit the commands of the brain to the organs. So if I say the cervical spine, the most of the nerves, they go to the upper limbs, the hands, fingers, so that they help in sensation, perception of the sensation of the hands, and as well as the movements of the hands. Let me say if there is any problem, disc or infection or something, any bone problem, impinging or pressing the nerve, so that nerve distribution will be paining excruciatingly, and in advanced stages there can be sensation loss, like people will say pins and rolls like, or paresthesias, tingling numbness, or any loss of sensation. In some people there can be a muscle loss and weakness of the hands, weakness of the limbs also. Similarly, if you see in the lower back, we commonly hear the term sciatica. That is a sciatic nerve, the compression of the disc in the lumbar spine may cause the pain going down the legs. So how severe is it? Is it very severe? That is called radiculopathy or radicular pain. Is it very severe? And is there any sensory symptoms, like are there any sensory symptoms like tingling and numbness and loss of sensation, and any motor power loss, means the foot drop or any muscle bulk getting reduced? Are there any problems with the urination, or you have to go for urine urgently, or you are not able to pass urine? So all these things determine that you have to go to the doctor immediately and get the medical advice as immediately as possible.
So doctor, what are the various treatment options that you offer to the patient comes with back pain in general? I mean, is it always surgical?
The main essence of the discussion is this thing. So many people, they don't go to the doctor fearing that if you go with the back pain, you will be advised surgery. It's not. So first of all, the first thing is clinical examination. If you go to a doctor, he will see you as a physical person rather than studying MRI and rather than studying you as a surgical subject. So what is the cause of your pain? Is it a muscle cause? Is it a nerve cause? And etc. So after that, if needed, any investigation can be done. It can be either MRI or an X-ray. So after that, depending on the severity, we will suggest the next line of management. Most of the times, 80 to 80% of the times, it will be non-surgical, and rather it can be non-interventional, meaning with only medication and physiotherapy. If the things are not falling in place, then it happens in 5 to 10% of the people who come to us with back pains. So then the surgical treatment or non-surgical interventions like pain interventions, injections, epidural injections are all will be undertaken. So if you see, even the surgical treatments nowadays are very advanced. Especially for the back, we have percutaneous endoscopic lumbar discectomy, where we don't give any scar to the patient, and he will not be submitted to any anesthesia. He will be awake during the procedure, and the discectomy or the prolapsed disc, which is causing the nerve compression and resulting in the symptoms, can be tackled within operation theatre on one-to-one interaction between the doctor and the patient during the surgery. And the advantage is it is a scarless, and anesthesia without surgery without anesthesia, no sedation, and the patient can be returning to the activity on the same day. So the discharge from the hospital on the daycare basis or at the max 1 day, and the early return to the activity can be taken place. And with so many advanced techniques available now, people fearing to go to the doctor with back pain should not be there, and rather it requires more awareness from our side also. We have to make the people aware that the back of all the back problems are not surgical, and even if surgical, they are not as diminished as they used to be before.
I think that's wonderful how the patient can return to normal regular activities on the same day of the surgery. I think that's really amazing.
It's real. It's a great advantage in terms of mobility. The first thing is you need not be restricted to the bed, and they go all their physical activities like going to the washroom and all starts from the day of the surgery, and they can go walking out of the theatre also. So this is a huge advantage in terms of the confidence towards the patient and early return to the activity also. So this is a huge advantage in terms of the physical thing also, like no violation of any structures which are given to us naturally.
So doctor, what are the preventive measures that one can take to prevent back pain?
And this is also a very important aspect of the discussion today. See, some things we cannot avoid because the lifestyle has changed, and we have to accept the fact. So we can no longer say that I cannot sit in the chair, I don't do work. No, everyone's lifestyle is almost the same. So we have to travel long distances, especially in the cities. The workplace is far off from your house. So you have to have a two-wheeler or four-wheeler drive at least 20 minutes, 30 minutes a day for many people. So these things we cannot avoid. And the dietary habits, yes, if you are indulged in work, so the dietary habits may not be regular. But what to do? So the next thing is, even if this changes scenario, in this change scenario, we should have some lifestyle modifications so that we don't suffer from these problems, like making a physical activity and exercise a routine part of your life. And the next thing is avoidance of junk food materials as much as possible. I can't say completely, so it's unavoidable these days, but restrict your dietary habits. Stick on to the foods which give you more nutrition, dry fruits and all, and like avoiding carbohydrates, excessive carbohydrate consumption and refined sugars. Avoid them and concentrate on the food materials which give you strength for the bones and muscles. And the work pattern change, follow the ergonomics of your work. So the chair, the sitting pattern, taking frequent breaks from the work, and these go a long way. And small stretch exercise at your workplace. So the people may think it's weird, how can we do exercise in our work? So it's not like simple neck movements, twisting movements, around this thing, rotation movements. Those can be done sitting on the chair. So but they go a long way in preventing your back problems. The thing is, have a proper posture and try to change your posture as frequently as possible, so that you can have a walk at your workplace. Small stroll may also help. So all these things, so though there are some things which we cannot avoid, especially the things related to your work. So there are many things which we can do for your body so that it adjusts to your work, and you don't suffer from the abnormalities or the problems.
So talking about posture, doctor, I just want to know what is the right posture, because I'm sure many of us have got this wrong posture, especially while looking down at the phone or while walking or while even sitting and sleeping.
So if you see, the spine is an S-shaped structure with lordosis. So we have to maintain that posture. So the erect posture with the support, the back support. Always, if you see, the more problems with the neck or with the people who sit before the system, bending their head, looking at the system, or the people who watch mobile, bending their heads, or the people who drive, because for the drivers, it's impossible to rest your head and see the road and drive. Always your head will be hanging. So every braking, speed breakers, and even the movement, the high-speed movement has a huge strain on your neck. And the same with the back. So they don't move the back. So you have to maintain erect posture. And as far as possible, the avoidance of the bending. Maybe many people, if you see especially software professionals who work from home, they sit on the bed and bend their back and work, and they sit in the sofas, bend and work. And even if you see the TV, you watch TV, people watching TV at homes, they will have TV to the side, and they will be sitting on sofa and watching the TV like this. So all these are abnormal posture. As far as possible, you have to keep your back erect and the neck erect with the headrest. Do the work, take frequent breaks, do the activity.
I think that sounds pretty simple. Maintaining a good posture throughout the day prevents back pain. So doctor, before ending this episode, what message you would like to give to the audience out there?
The spine health is becoming a pandemic, just like obesity had become, because it's more concerning these days, because the working population, the younger population is being affected. It affects your work, it affects your life. If your back is aching, if your neck is aching, you cannot concentrate on your work, first point. And the second point is, you feel sick and restricted in your movements. Rather than going to that thing, what my sincere request and appeal to everyone is, concentrate on physical activity, concentrate on your diet, have a restriction over your habits like smoking and alcohol. Preferably if you can quit smoke and restrict your alcohol intake, and then have a healthy lifestyle, have a healthy back.
So thank you, doctor. It was wonderful having you here on the program today.
It's the same here, and I'm very happy to share many of my experiences and many of the health-related, back-related issues in this session.
So this brings us to the end of this episode. Hope this episode was informative on the topic lower back pain, its most common causes, and its preventive measures and treatment options. Do join us for the next week as well. Until then, take care and stay healthy.